Hi, this is Mike Miller. I'm here at Bread for the City in Washington, D.C. with George Jones, Bread for the City's Executive Director. We're here to talk about health reform in Washington, D.C. Thanks for taking the time, George.
It's my pleasure, Mike.
George, have you seen the impact of the health reform law on Bread for the City's clients already?
I think some of the things that we've seen are kind of 6 degrees of separation in terms of the impact. For instance, the district has, over the last year and a half, looked to aggressively shift people who were formerly in the DC Healthcare Alliance into Medicaid. And that sort of ability to move and suddenly make those formerly ineligible recipients of Medicaid eligible for Medicaid was a part of the reform, a part of the sort of, if you will, broadened latitude that the federal government has sort of crafted into the ACA Act.
And that shifting financially benefits DC because they get more federal match from people who are in Medicaid than they do in the Alliance.
That's right. The Alliance had no match to it, and Medicaid has, of course, a 75% match, federal 75%, 25% of the district. Unfortunately, Bread for the City actually gets less for those Medicaid visits than it was getting for the Alliance, so it had what maybe the government would call an unintended negative impact on sort of a nonprofit like Bread for the City.
See, and just so we're clear, the Alliance started in 2001 as a mechanism the district created to give people with low income but not eligible for Medicaid access to health insurance. They're 5 years ahead of Massachusetts. Do you think that experience of having set that up and creating sort of a network of discussion and recognition is going to help get people enrolled in the new DC insurance marketplace exchange next fall and into next year?
I think that the fact that the district has been at a reform really for now better than a decade, really does sort of position us in a way that is, this is a kind of normalized behavior. I was reading something recently that talked about the churn associated with people having to change from one kind of insurance vehicle to another. Well, we've been dealing with that for over a decade now, and it's not always, there's both negative and positive impacts for that, but at least there's a kind of administrative muscle that both on the, I think on the government side and on the sort of private side that already exists in terms of helping people navigate those kinds of systems. So I think we are better positioned to sort of deal with the nuances of the exchange and the other elements of the Affordable Care Act.
Yeah, you bring up a great point, because one of the proponents of having Medicaid people in exchanges is that when they so-called churn, going from Medicaid to private insurance and back and forth, if it's all in the exchange, it makes that easier. But I think you're making a great point that here in the District of Columbia, they've figured that out, and it's not that big of a deal. So that putting people on Medicaid into private insurance through the exchanges may have some benefits in theory, but people have talked about having a higher cost because the private insurance through an exchange would probably be higher than costing than traditional Medicaid.
Well, again, I think that there are some things to be said for us already having sort of experience with that and knowing how to, in some ways, problem solve maybe in real time. I do think that one of the risks is that, particularly in those programs where there are people who may be undocumented or other kinds of sort of challenges with establishing the eligibility, people who don't have, people who are homeless and those kind of things, that sometimes you find that helping them navigate the system is still difficult, even with the experience, because the documentation and proving the address and that kind of thing. And so that churn, if you suddenly have to move into another program, not because it's time for you to be recertified, but because suddenly the rules shifted, those of us who work with those populations have to do that again. We have to sort of help them sort of reapply, re-qualify, and those kinds of things. This can be a little bit challenging for residents who are not used to navigating those kinds of systems.
People have got enough problems besides this one. I mean, Bread for the City, besides the medical clinic here, has a legal clinic and a social services program. Can you talk more about how those programs work together to try and help people who've got those kind of multifaceted challenges for accessing, whether it's Medicaid, the Alliance, or maybe in the future the health insurance exchange or whatever?
Sure. Yeah, so as you know, Mike, we have 5 core programs at Bread for the City: food, clothing, medical, legal, and social services. And we've always had, or for most of the time this organization exists, we've had an intake system that was designed to do exactly what you said, which is help new clients or clients moving coming into our system not only access our programs, food or clothing or medical, whichever combination of those things they need, but to access any of the sort of government-based programs they need, some so-called entitlement programs that a person might be eligible for. So whether it was Medicaid or food stamps or affordable housing, our systems are designed, our staff are trained to understand those. We go to a great length to make sure we understand the nuances of the programs, establishing relationships with the staff, the administrative staff at the various government offices, so that when our clients have to sort of navigate those, and when they need support, not all of them do, the ones for whom, again, navigating those systems is overwhelming or threatening, we can be there to sort of essentially help walk them through that. And that's what we anticipate having to do and being in position to do when the exchange is really up and running.
So it's not just even like language translation, it's bureaucratic translation in a lot of ways.
Oftentimes it's that first, and then the other kinds of challenges, whether it's language or other kinds of systems.
Well, I know Bread for the City also works with a lot of other community-based organizations around DC, referring clients back and forth for different programs they might have a specialty in or resources or access to. Has there been discussion amongst the community of community-based organizations that help low-income people here in DC about preparing and setting up for the insurance exchanges and other benefits of the health reform law that are starting this year and going to go into future years?
Yeah, Bread for the City is a member of the DC Primary Care Association, and so the 13 or so community clinics that are going to be right in the thick of the whole new exchange meet pretty constantly. I mean, once a month minimally, sometimes more frequently. And one of the things that's been on the agenda in recent years, as you can imagine, is this healthcare exchange. And again, one of the real difficulties is, as you and I were discussing earlier, it's taken a while to sort of understand what the real elements are and the real mechanics of the exchange are going to be. And so we've been practicing at sort of collaborating around that, even though we haven't always known exactly what the fixes would be. But I think that's another thing to your point about, and to my point earlier about sort of us being in this reform kind of dynamic for now a decade or so. We've gotten sort of used to sort of coming together and talking about what our common experiences are. And I think that's the most important piece about the work, is that not each of us has the same experience with the system, but sort of collectively we get a chance to sort of know what some of the fixes are to whatever sort of issues come up for a particular group of clients or for any particular clinic that's working in what really is a kind of safety net clinic community.
Well, yeah, having worked together over the years, it's very good, because what I always tell people I work with is the worst thing you can go into a new meeting and say is, "Hi, my name is."
That's right.
You all work together, know each other, so it's just one more challenge you're trying to address, as opposed to got a challenge and then you got to try and figure out who to work with.
Who's who in the room.
Right.
Yeah. So we don't have that problem. I mean, most of the people have been at the table for, like I said, more than a decade.
Well, that's great. That's great. What are the biggest challenges facing Bread for the City over the next 6, 12, 18 months?
It's a good question. One of the things that's sort of at play as we face healthcare reform is that we completed a 11,000 square foot expansion of our Northwest Center. And most of that expansion was centered around expanding of our healthcare practice. We sort of envision it growing at least twofold, going from some 9,000 patient visits a year to ultimately probably topping out at 18,000 to 19,000 patient visits, from 3,000 unique patients to 6,000 unique patients. We did that to a large extent anticipating healthcare reform and anticipating sort of this opportunity to provide even more access to medically underserved communities. Tends to be the communities we focus on. The challenge is that we, coming up with the revenue to sort of pay for those additional visits, and one of the real difficulties of Bread is we are not a federally qualified health center. Here in the district, more and more, that is the kind of healthcare paradigm that makes providing care and expanding care much more possible. To just sort of put it briefly, FQHCs receive 100% of the cost of care when they get reimbursed through Medicaid and Medicare. So if your visit is $130 a visit, or $140 as the case is for many of the practice clinics in the area, they get $140 per visit. In fact, I think the going rate for FQHCs right now is $150 per visit, because it's normalized across each of the clinics. Bread has actually just decided to try to become an FQHC, because we want to be able to expand access, but the only way to do that is to really recoup more of the cost of that care. Unfortunately, it looks like the best we'll be able to do in the short run is become what they call an FQHC lookalike.
Right.
Gives you the reimbursement rates, which gets us most of the way there in terms of that challenge of being able to afford, expanding access. But it doesn't give you the kind of grant support that pure FQHCs get through to that federal program.
Right.
So that's a big challenge though for us, is trying to even become a lookalike and sort of creating our systems to comply with all the rules and regulations associated with being FQHCs.
Yeah, the Section 403B clinic program has gotten to be very complicated with all the different variants, both the actual FQHCs and the lookalikes and all the provisions and everything else. But fundraising is a challenge for all nonprofits, I understand that. But with Bread for the City's track record and awards over the years and your great leadership, I see great things ahead. So,
yeah, we feel optimistic about it, and you're right. I think we've got a good track record with this. If we can tap into this federal program, I think we'll close whatever gap we have in terms of at least sort of current funding challenges.
Well, hopefully the economy will continue to improve, and things will get better, and we find support for both the legal clinic, the social services clinic, the food program, and all the ancillary programs that Bread for City has around those, like the representative payee, the AA meetings, and all sorts of other, the food bank, the
food pantry.
The food pantry, but also like the farmers market and the orchard.
That's right.
Yeah.
Established out in Bellsfield. So doing all kinds of incredible and innovative things. And as you sort of alluded to, historically those programs have been privately funded. And so you're right. The sort of the economy's well-being is also a part of the equation that will really sort of hopefully, allow us to move forward in the future with steady and sound financial backing as we kind of still continue to innovate and grow our programs.
That's great. Thank you, George. Thank you for your time. This is Mike Miller on behalf of Bread for City and George Jones. Thank you for watching, and be well.